Southbridge, a beacon for quality local health care, and nothing has shone brighter than our own Harrington Memorial Hospital. Opened in 1931 and built from the generous donations of land and money by the entire community. Born out of the Depression, survivor of wars, floods, recessions, and even tornadoes. Ever expanding, its services now encompass 23 surrounding communities. The mission, never wavering, to provide high-quality medical services to its patients in a safe environment and in an efficient and effective manner, which provides superior value to the residents of South Central Massachusetts. Time has moved forward. Progress, innovation, technology, change have made their mark. On July 1st, 2021, after years of careful planning, a new era began, and a new name, UMass Memorial Health Harrington. Join SCTV for an inside look at the 2-year mark of the merger between UMass Memorial Health and Harrington Hospital. Learn what's next in our ever-evolving landscape of local healthcare.
The second word was bittersweet. And maybe some of you were there when that was said. In the moment it was said, I felt it was really appropriate. It was a realization that our decision and subsequent action was the end of a 90-year journey as an independent community hospital. We were joining that list we didn't want to join, those that couldn't stay independent. But it was also the first step of a new journey as part of the UMass Memorial team. I was honored to be invited to join first the membership group at Harrington, and then quickly thereafter they formed a strategic committee. And having worked in the industrial sector, we dealt a lot with strategy, the tactics, how to go through the process. And so I was very honored to be a part of that committee with other members of the Board of Trustees, other members of the corporation. And you asked me if it was the right thing to do. And the process was about a 2-year process. And we looked at many options. And we believe at the end we made a decision that was the best option so that Harrington could continue to be, that we could continue to serve those within the communities that surround us. We'd be able to provide long-term care, high-quality care for the long.
So if I could, would you please stand? Because I'm really going to call you out. That you participated in this effort, and you should feel really great about that time and commitment. Dr. Powers at the time was medical staff president.
We chose, to partner with the UMass system. We went into it knowing that they had the same mission as we did and same kind of workplace culture. So the immediate change was really minimal. We still are functioning relatively independently, taking care of our local patients, but it was just a stronger partnership with the medical center itself. The integration of the services is somewhat slower, and it's partly limited by the capacity of the physicians. It's not like they weren't busy to begin with, so it's not like they're sending people down here more frequently or we're going there. There is some of that, but that's been kind of a slow move. Some of the biggest part of the integration is just in processes, network systems, like we're going on to their Epic, which is their electronic medical record system, and that is huge. That was a big part of the negotiations for the mergers, because we would never be able to afford that as a standalone community hospital, but that, along with several other things, is available now to us because we can leverage the system resources.
If it wasn't for Charles Harrington, none of us would be here today talking about Harrington or Harrington being part of UMass. So I wanted to thank you.
Yeah, 2 years ago, July 1st, we went from being an independent hospital to become part of UMass Memorial Health. It's been a lot going on in those 2 years. We've been very pleased with the results, and we have a lot more to look forward to as well. I would say being independent, there are many hospitals that are, not many, but there are a few still left independent, and they're going through major struggles. Fortunately, we're in a system that is strong and supportive, and the transition has been very smooth. The biggest project we have in front of us is we're converting our electronic medical record to Epic, effective October 1st. That's a huge benefit to us, probably valued at about $50 million, which was part of the original definitive agreement. I would tell you that we've gotten a lot of benefit around the brand name of UMass that has helped us in the community. And the signs have changed, so we're now officially signed. You go to the front entrance and you see all the new signage. And I would tell you we're able to provide further services than we did before. So I would tell you this has been a great 2 years, and we have much more to look forward to. Today is really an opportunity to celebrate that success and really identify some things going forward, such as also a new ICU that we're going to be building, an 8-bed, 33% expansion of our ICU capability. So very exciting times.
So it's a marriage, as you said, not an acquisition. This is about us working together towards a common goal of improving the health of the diverse populations that live in this part of the state. Under the best of circumstances, without a worldwide pandemic and workforce shortages and challenges in terms of IT security and everything else, a merger of this type is very difficult. And we never think of it as an acquisition. It's about a new partnership and how we're going to work differently with the community that has always been a part of us. Historically, we've provided tertiary services here, and the helicopter comes out and takes care of patients, and the sickest patients were typically sent into Worcester. But now with the partnership that we have with Harrington Health, we're providing primary care here, secondary care here, basic level hospital care here, and with that strong connection to that tertiary partner. So it's been an amazing partnership, and the amazing part is how few bumps in the road we've had, given everything else that's going on in the world. So we just really couldn't be happier with the way this has turned out.